Well, for more on this, let's now speak to Jackie Maimin, the CEO of the Independent Community Pharmacy Association. Jackie, a very good afternoon to you. Thank you so much for joining us. First of all, remind us again what the bone of contention is for the unemployed doctors and pharmacists taking to the streets.
Thanks very much for having me. Yes, I can't speak on the doctors, but I can certainly speak on behalf of the pharmacists. Right. So I think, one of the challenges that we have is that the posts, certainly in the public sector, appear to be dwindling. There is far more reliance on the pharmacist assistants under indirect supervision of pharmacists, and the number of pharmacists being employed seem to be lowering. And, I really think that we need to focus on the advantage of having a pharmacist in a healthcare facility where there are medicines, because it reduces medication errors, it certainly improves patient safety, and it ensures that we're able to adequately counsel patients. So as the Independent Community Pharmacy Association, we absolutely support our youth who are looking for jobs. To have a pharmacist is essential in terms of patient safety when medicines are prescribed.
And Jackie, their concerns not only reflect personal struggles per se, but also expose the cracks in the provincial healthcare system, which is already buckling under strain of being understaffed and having limited resources and rising patient demand. So in light of this, what are your expectations then in terms of government's ability to address these concerns?
So I think it's a two-pronged thing that we need to look at. So there's the public and the private sector, and there are struggles on both sides. Quite correctly, a lot of these pharmacists, when they left university, they went and did their internships, they then did their community service, and as such, they've started a career in the public sector. And I think the government really needs to look at unfreezing these positions. We have heard of lots of pharmacist positions that have been frozen. There seems to be a heavy reliance on assistants. I know just recently they've now upped the ratio to 1 pharmacist for every 5 assistants. Previously, it was 1 to 3, and this puts tremendous strain on the pharmacists and really reduces our ability to be able to give adequate patient care. I really think that they need to relook this. We need to increase the number of pharmacists. It will ultimately reduce medication errors and assist in patients reducing overall costs. Then on the side of the private sector, I think that we really need to look at making an environment conducive to the pharmacist not only being an employee, but being able to open their own pharmacy and be a true professional and entrepreneur. There are many hurdles there, and I know that these students or these pharmacists actually took a memorandum to Pharmacy Council today as well. And I think Council really needs to look at reducing the hurdles to opening pharmacies. We need these young pharmacists opening pharmacies in areas where there are low resources. Many of these pharmacists would go back to where they come from and open pharmacies if it was more conducive to doing so.
And South Africa is already grappling with the brain drain in the medical field as skilled professionals migrate to countries with better pay, working conditions and stability. And how much of this would you attribute to the unemployment of pharmacists and leading to the healthcare system in South Africa going under incredible strain?
Oh, absolutely, it's contributing to it. I mean, those that do manage to get jobs at these clinics, they are under such tremendous pressure. They are responsible for everything. They're having to check numerous assistants, and this means that they leave. And when they leave for good, and that's very sad. We cannot afford to lose these professionals. There was a study done a few years ago on healthcare professionals and the number of doctors and pharmacists and nurses that we need. There's the WHO guidelines, and we are well below that. And if we want to bring in universal health coverage, the first thing we need to do is look at our greatest asset. And our greatest asset are our healthcare professionals. We cannot afford to lose them. But yes, if you're unemployed and not wanted in the country where you trained, and there are attractive alternatives, they will take them. So let's keep this youth who want to work in South Africa and make a difference to the people of South Africa. Let's keep them. Let's find them employment. Let's make sure that the whole environment is conducive to accommodating these youngsters.
All right, Jackie, great chatting to you. Thank you so much for joining us. We do appreciate your time. Well, Jackie Maimin, he's the CEO of the Independent Community Pharmacy Association.